The upper extremities are made of the bones of the shoulder girdle, the arms, the forearms, and the hands. The humerus is the upper arm, and that's the upper arm bone, which is where your biceps and tricep muscles are, and allowing the shoulder to rotate, flex, and extend. The collarbones, which are your clavicles, and the scapula, which are your shoulder blades, form the capsule into which the proximal portion of the humerus inserts to form the shoulder joint. This is referred to as a ball and socket joint. The forearm contains two bones, the radius and the ulna. The lateral side is the thumb side, and the medial side is where your ulna is. The ulna is the longer of the two bones. The olecranon, which is the elbow, is the joint where the humerus connects to the radius and ulna. And the forearm is connected to the carpals, which are the bones in the wrist, the metacarpals, which are the bones in the hands, and the phalanges, which are your fingers as well as your toes. The lower extremities are made up of the bones of the pelvis, upper legs, lower legs, and feet. These bones support the body and are essential for standing, walking, and running. The pelvis is a bony ring formed by three separate bones that fuse to become one bone in an adult. The lower extremities are attached to the pelvis at the hip joint. The hip joint is formed by a socket of the acetabellum, the hip bone, and the head of the bone, head of the femur bone. The femur is your thigh. The head of the femur is the upper end of the bone and is shaped like a ball. The femur is the longest, heaviest, and strongest bone of the body. That type of joint right there is called a ball and socket joint. The knee joint, the knee is known as the patella. The knee joint is a hinge joint, allowing the distal leg to move in a flexion and extension. It is protected anteriorly by the patella, again the kneecap, and attaches to the femur to the lower leg bones, which are the tibia, which is your shin, and the fibula. The tibia is the larger of the two bones of the leg. The lower leg attaches to the foot by the ankle, which is similar to the wrists of the upper extremities. Like the hand, the foot contains several smaller bones and joints, allowing free movement of the foot and ankle. The tarsal bones make up the back part of the foot and the heel, and the metatarsal bones make up the main part of the foot. And again, the phalanges can be used for fingers or toes. In this case, we're talking about the toes. The phalanges are the foot's equivalent to the fingers without the same movements. The toes move in a flexion and extension only. The muscular system gives the body shape. It protects the internal organs. It provides for movement of the body, maintains posture, and helps stabilize joints, and it produces heat. Muscles are classified according to their structure and their function, just like the bones are. Skeletal muscles are voluntary muscles. Smooth muscles are involuntary muscles, and then we have cardiac muscles, which are also involuntary. For example, if I'm walking along the street, I'm using my skeletal muscles, which are voluntary, to use the walking motion. If I'm eating a bowl of Wheaties, chewing, those are voluntary muscles, but as I swallow and the food makes its way down the esophagus into my body, those are involuntary muscles, those smooth muscles of the digestive tract. And then we have cardiac muscles. Cardiac muscles is your heart, and that again is involuntary, and that allows your body to pump blood throughout the entire body. Again, your involuntary muscles, it's important that they are involuntary because, as you can imagine, it would probably be quite difficult to sleep and have to think about, okay, breathe, now heartbeat, heartbeat, breathe, breathe, heartbeat, while you're sleeping. So these things go on as without you having to tell your body what to do. Excuse me. Skeletal muscles move the skeleton and produce heat that helps maintain a constant body temperature and maintain posture. Most skeletal muscles are attached to bones by means of tendons. Tendons are strong cords of connective tissue that firmly attach the end of the muscle to a bone. The tendons of many muscles cross over joints, which help stabilize the joint. Ligaments are tough groups of connective tissue that attach bones to bones and bones to cartilage. They provide support and strength to joints and restrain excessive joint movement. Rupture or tearing of a ligament can lead to pain and/or impaired function of that joint. Skeletal muscles do not contract unless they are stimulated by a nerve. When contraction occurs, the bones work together with the muscle as simple mechanical lever systems to produce body movement. For example, when the forearm bends or straightens at the elbow, the bones and muscle functions as a lever. Smooth muscles are found within the walls of tubular structures of the GI tract and the urinary system, blood vessels, the eye, and the bronchi of the respiratory system. Smooth muscles are involuntary because you cannot control them. Well, you may think, well, I can control my breathing. I can just sit there and hold my breath. Well, eventually you'll pass out and you will start to breathe on your own. Smooth muscle contractions are strong and slow. They respond to stimuli such as stretching, heat, and cold. In the iris of the eye, smooth muscles regulate pupil size. Contractions of the smooth muscles that surrounds the intestine cause food and feces to move along the digestive tract. And in blood vessels, smooth muscles help maintain blood pressure. And in the bronchi, constriction of smooth muscles may result in impaired breathing. Cardiac muscle is found in the walls of the heart and produces the heart's contraction and pumps blood. Cardiac muscle is found only in the heart and has its own supply of blood through the coronary arteries. It can tolerate an interruption of its blood supply for only a few short periods. Normal cardiac muscle contractions are strong and rhythmic, and like smooth muscles, cardiac muscles are involuntary as well. Here's just a little comparison chart of the various muscles, where they're located, their functions, and the type of control.